According to the American Heart Association, nearly 3 million Americans live with atrial fibrillation, or Afib. It's the most common form of an irregular heartbeat, and it's caused by the abnormal firing of electrical impulses to the top chambers of the heart.
Afib can lead to blood clots, stroke, heart failure, and other heart-related complications. Dr. Miro Pev is a cardiovascular and thoracic surgeon at SSM Health. He joins us now to talk about how Afib is treated. Thank you so much for joining us today.
The pleasure is mine. How are you?
What is the biggest concern if you do have Afib?
Well, let's just say a few words about Afib, what that is. Afib is a disorganized, chaotic rhythm of the upper chamber of the heart. And the upper chamber is essentially quivering and not beating effectively. The main concern with the rhythm is first that your heart is not working as effectively as it should. The function is worse. But second, you can form clots in your heart. There's a little piece of the heart, a little sac. It's called the left atrial appendage. So when your heart fibrillates, it creates a turbulent flow within this appendage that results in building of clots. And those clots can actually result in strokes, which is a big deal.
What are some of the symptoms people should be looking out for?
Well, there are several types of Afib, each determined by the duration of the condition and the underlying reasons for it. So common symptoms include general fatigue, palpitations, dizziness, shortness of breath, weakness. Some of those symptoms are not specific at all. The problem is that many people might not have any symptoms, or their first symptom could be just the experience of a stroke.
So if you do have Afib, what treatment options are available?
That's an excellent question. I will break down the therapy in three parts. First, medications that slow down your heart rate. Beta blockers are an excellent example for that. Second, medications that prevent the complications of Afib, such as blood thinners, medications that prevent building of clots in your heart. And third are the therapies intended to eliminate the mechanisms causing the Afib, such are ablation, like catheter-based ablations, or surgical, which is by far the most durable option.
Obviously, this is not a condition anyone wants to have. Is there a way to prevent Afib from happening in the first place?
Well, that's for sure is a million-dollar question. Well, while the most common cause of Afib is a problem with the structure of the heart, some people with Afib have no known heart problems or damage. Some may have developed it from another underlying condition, such as high blood pressure, obesity, sleep apnea, diabetes, thyroid disease, chronic lung disease. It's such a wide variety of medical conditions. A person's family history also plays a role. What people can do is maintain a heart healthy lifestyle, and that's one of the best ways to decrease the risk of onset of Afib. Get regular exercise, maintain healthy weight, eat a diet low in salt and saturated fats, and exercise a lot. I think that should help.
Dr. Pev, is this something that can affect people no matter their age, or is there a specific age group that you really see this condition in more?
We certainly see that more in elderly individuals. With every decade after 50 years, the incidence grows. But we have seen Afib also in younger individuals.
So Dr. Pev, thank you so much for being here with us today, and of course for all you do to take care of our hearts.
Thank you so much. The pleasure was mine. Bye.